This is a plain CT scan orbit of a 16 years old male patient who presented with inferior rectus and lateral rectus palsies. Now please observe, this is the right eyeball here. This is a well-defined fat attenuation lesion which lies below right eyeball. Right eyeball is displaced upwards. Now this is a curvilinear calcification along its supromedial border. Small amount of soft tissue component is noted in its posterior part. Now its CT density is approximately -130 HU. This is the inferior rectus muscle which is stretched along its superior surface. Now please observe that this is the lateral rectus muscle on left side, while this is right lateral rectus muscle. This is atrophic. Posteriorly, this fat attenuation lesion extends up to the orbital apex. There is no intracranial extension. Right eyeball is displaced superiorly, its posterior surface is flattened. Now please observe that right orbit is enlarged. Surrounding bones are thinned. The floor of right orbit is pushed downwards. It is intact. Medially, it lies in contact with lamina papyracea. It is intact, it is displaced medially. There is no intraconal extension. Orbital nerve is normal. These are the bone window details. Please observe enlarged right orbit, thinned walls. The roof of right maxillary sinus is displaced downwards, it is intact. This is right lamina papyracea which is bulging medially, curvilinear calcification along the supromedial border of the fat attenuation lesion. This is the inferior rectus muscle which is inseparable from the lesion. Now this is the atrophic lateral rectus muscle here. The lesion extends up to the orbital apex. Now please observe that this is the inferior orbital groove here. This is the infraorbital foramen. This is the sagittal scan. This one is the fat attenuation lesion. Well-defined floor of right orbit is depressed downwards, curvilinear calcification. Anteriorly, it extends below the right eyeball which is displaced, and superiorly, its posterior wall is slightly flattened. Posteriorly, it extends up to the orbital apex. The optic nerve and rest of the extraocular muscles are normal.